Green Bay tight end Tucker Kraft is questionable to return with a right knee injury sustained on this play, and in this video we'll take a closer look, injury mechanism, and what I think could have happened to the Packers star. Welcome back everybody, I'm Dr. Brian Sutterer, and the goal on this channel is to teach you more about the medical side of the sports world. So let's take a look at what happened here with Tucker Kraft. Now the official word, I'm recording this in the third quarter, he's officially questionable with a knee injury. I will be very surprised if we see him return. I think there are two different scenarios I'd be concerned about here. Obviously, one being more optimistic and the other more concerning. As we look back at this play, remember with any injury, it's a matter of which structures are going to be affected by the forces that are applied to the joint of question. So as we look at what's happening with Kraft's right knee, think about the direction that the forces are being applied, what structures that is going to stress, to think about what injuries are going to be on the differential. As he goes over here and plants that right leg right here is in a straight position, and then what we're going to see is actually it looks like his own teammate, as a result of this attempt to get through the block, falls backwards into him and imparts a little bit of this force almost from anterior lateral to posterior medial. So it's kind of hitting him on the front outer part of his knee, driving the knee downwards and inwards into this valgus position. And there we can see significantly how much valgus, or that inward movement, is being imparted on his knee as a result of that injury. Always look at the joint above and below. So here we'll always keep in mind the ankle. It doesn't look like there's any significant amount of eversion or force applied through the ankle. Obviously nothing up at the hip in this case. And so I think we can just focus specifically on the knee. So think in this position as his knee is straight right here, but then gets bent inward. That force is going to stretch the structures on the inside of the knee. That is going to lead to, most likely, number one, an MCL sprain. MCL is the medial collateral ligament. That's going to sit on the inside of the knee, running from north to south between the tibia and the femur. LCL on the outside of the knee. So as this force comes through, knee gets pushed inwards, valgus force, that's going to put tension on and stress the MCL. And so I think most likely number one, and honestly best case scenario, would be an MCL injury. Now I will say he reacted a little bit more significant than you would see for just a typical mild MCL. Oftentimes with an MCL, you'll see guys kind of grab more the inside of the knee. Kraft here really does seem to be grabbing like the entire knee, and even has his hand on the outside like he's holding to stabilize the joint. Not really sure, we can't look too much into that, but sometimes it's at least a clue where players are grabbing. The other item on the differential here is honestly an ACL tear. This mechanism is certainly a mechanism that could result in a tear of his anterior cruciate ligament. A couple of features that I don't like in terms of more chance of an ACL injury. Number one, we can see how his trunk is leaned over the injured side. That trunk leaning over the injured side is going to help contribute to the rotational forces that go through the knee and through the lower leg that can lead to the rotational load that's often required to tear an ACL. An MCL sprain is going to be just a straight valgus load that injures it. An ACL tear typically has some degree of a rotational component to it, and we'll see that rotational component from the tibia rotating, the shin bone rotating, also from the way that the trunk leans over the injured side, and the femur can rotate as well. We call it this overall knee abduction moment, where the distal tibia is coming up this direction, the knee is rotating inward. So there's an additional rotation that can also contribute to the ACL being torn, because remember the ACL runs front to back, but also at a little bit of an angle, and so that rotation is also going to put the ACL at risk. One good thing that goes against an ACL injury is that this is very quick. We don't see the foot get really stuck into the ground with an excessive amount of force translated through it. As soon as that load from his own player comes in here and hits the knee inward, number one, it doesn't look like his foot is quite anchored on the ground, but then his foot releases up off the ground pretty quick. And a short amount of ground reaction force time, a short amount of contact on the ground time is going to be a good prognostic factor for making something like an ACL less likely. So number one, looking back at this, MCL is going to be the first thing to be concerned about. That can span anywhere from a week or two absence up to season ending. If the tear occurs at the MCL origin, higher up on the femur or the thigh bone, that's a better prognosis. You're on average going to be looking at a couple of weeks, maybe up to a month to 6 weeks. If it occurs down at the lower portion of the MCL where it inserts on the tibia, that's going to be a longer recovery, sometimes surgery, and could be season ending. That's rare compared to your typical MCL sprain, can brace, especially in football. We might even see him back out there in a week or two if it's a mild MCL. But always keep ACL on the differential. Again, that trunk rotated over the injured side. We see that knee go inward from the external force. It really depends on how much rotation was involved, how long that force was imparted through the knee, and how much ground reaction force was coming up through the foot, which I think in this case is less likely than just the MCL, but keep that on the differential. Also, depends on when we got the report of questionable to return. If it was after they did their physical exam, which probably is the case, then you can assume they did a test for his ACL, felt reassured, and that's part of why he was questionable. If they had tested his ACL and it had been abnormal, he would have been ruled out. So if we got that official report relayed to the TV after they had done their exam, that's a good sign. Sometimes with the communication, right, they're on their way back to the locker room. Hey, we're going to go evaluate him in the locker room. We're evaluating his knee. At that point, you might have not completed your evaluation, so you'll say questionable. So a little bit of a nuance, but overall, I think things favor prognostically. Best case, I think here, MCL sprain for Kraft. That's it for the video. Let me know as always any questions or comments down below. And until next time, we'll see you later.